We want to remind our listeners that this program is for informational and educational purposes only and not intended to substitute for professional veterinarian medical advice, diagnosis, or treatment. The Animal Medical Center does not recommend or endorse any products or services advertised by SiriusXM.
Welcome to Ask the Vet with Dr. Ann Hohenhaus. This is the place to talk about your pets and get advice with a top veterinarian from the Animal Medical Center in NYC. Hear from the leading authorities on animals and ask your questions. Now, here's your host, Dr. Ann Hohenhaus.
Hello, everyone, and welcome to Ask the Vet. We have a podcast for people who love their pets and want the latest in pet health and animal news. I'm your host. I'm Dr. Ann Hohenhaus. I'm a senior veterinarian and director of pet health information here at the Schwarzman Animal Medical Center in New York, where today we're recording from. I'm excited to highlight our incredible guest who works providing free care to pets of people experiencing homelessness. Our guest today is none other than Kwane Stewart, a veterinarian and director of Project Street Vet. Dr. Stewart was named CNN's 2023 Hero of the Year for his outstanding efforts in caring for pets of homeless people. So stay tuned to learn more about his inspiring mission and the real difference it's making in communities throughout the United States. The Schwarzman Animal Medical Center is the only Level 1 veterinary trauma center in New York City, and we have 114 years of experience being the very best place for your pet. If you're looking for advice on maintaining your pet's health, I'm here to help. Just send me your questions. We have an email that's really easy to remember, askthevet@amcny.org. That's one word, askthevet@amcny.org. And I'll answer your questions on next month's Ask the Vet program. And I'll give that again later in the show, so if you need a pen or pencil to write it down, you'll be able to pick it up during the break. And now it's time for our trending animal of the month.
It's time for the internet's most talked about animal.
In June, during a camping trip at Yellowstone National Park, a 2-year-old Siamese cat named Rainbow darted into the forest, leaving his owners, Mr. and Mrs. Anguilo, frantic as they searched tirelessly for days, but they were met with grim news. Grizzly bears and coyotes had been spotted in the area, and it was feared that Rainbow had fallen prey to a predator. The heartbroken couple eventually left the park, but as they crossed into Nevada, a double rainbow appeared, which they took as a sign of hope. Incredibly, nearly 2 months later, and more than 800 miles from Yellowstone, Rainbow was found wandering the streets of Roseville, California, just 3 hours north of the Anguilos' home. The local Society for Prevention of Cruelty to Animals identified Rainbow via his microchip. And the couple believes Rainbow likely hitched a ride along the way, given the vast distance and challenging terrain of mountains and deserts between Yellowstone and California. Although Rainbow lost 40% of his body weight by the time he was found, he's been safely home since early August and is on the road to recovery. Understandable, Mrs. Anguiano is now hesitant to take her cat on future trips. But what I'll tell you is that this story is a great highlight of the value of microchipping your pet. And it's not just putting that microchip in, it's keeping your contact information up to date in the microchip registry. So folks, be sure you've got your pet microchip, especially if you're taking it on a trip somewhere a long ways from home. And now I'm honored to welcome Dr. Kwane Stewart. Dr. Stewart is a veterinarian with an incredible mission. He provides free veterinary care to pets of individuals experiencing homelessness through his nonprofit Project Street Vet. Recognized as CNN's 2023 Hero of the Year, Dr. Stewart's work spans across multiple cities in California and beyond. And the Project Street Vet offers everything from routine wellness checks to life-saving surgeries for pets in need. His compassionate approach to veterinary care is transforming lives, not just for the animals, but also for the people who love them. Dr. Stewart, I'm so happy to welcome you to Ask the Vet today. Thank you so much for joining us.
Yes, thank you. Thank you so much for having me.
Every time I have a veterinarian on the show, we just have to ask, When and why did you decide to become a veterinarian?
We probably get that question asked of us, and more than any other question, more than why is my dog scooting or why is my dog vomiting? I feel like people are just enamored with the reason why we wanted to pursue this profession. For me, I was young. I was about 7. I think that's the case for a lot of us. We figured it out pretty early on. But I had come out of a movie. I don't know if I'll try and let you guess the movie. The movie featured a beautiful black majestic horse and a boy. And my mom let me play hooky one day from school and took me to the movie. I was just completely transfixed, and I cried, I laughed, and when I walked out, I was holding her hand. I looked up at her and I said, when I grow up, I want to be an animal doctor. I didn't know what a veterinarian was. I said, I want to be an animal doctor when I grow up, and I was 7 at the time. And she said, from that day forward, I took an interest in science and animals and never strayed.
But you're not a horse vet.
I'm not a horse vet. No, interestingly, it was just something about seeing that animal injured and the bond the horse and the boy shared together. It was like a love for living creatures. And it was the black stallion. And from that day forward, I wanted to be able to care for him.
See, I would have said Black Beauty, but Black Beauty is a book about a little girl and a horse. So I knew that wasn't the right story, but the Black Stallion movie came after I was watching movies of that sort. I'd moved on to a different set of movies, I think, by the time the Black Stallion came out. I'm kind of an old yeller, 101 Dalmatians and Big
Hmm.
Red. I'm kind of a Disney girl when it comes to
Oh,
animal
okay.
movies.
Okay.
Um,
We can agree on that.
well, yeah, and Lady and the Tramp. Lady and the Tramp has a great Siamese pair of Siamese cats in it too, like our rainbow cat that got saved by a microchip. So what inspired you then to start Project Street Vet? And has the mission changed since the time you started it?
I uh I guess it's evolved. Yes. Um for the longest time I did this work solo. I was just a one-man band, and it started back in around 2012, 2013. I was a shelter vet during the recession. It was a job I took on and had no idea at the time how it was going to impact my life. I guess in some ways my emotional welfare, because we're all very aware of the emotional toll this industry can take on us, why our suicide rate is sadly so high. The shelter did not help. I uh, I was there for 5 years, and we were a municipal shelter in a very depressed area of California, and we were euthanizing upwards 50, 60 dogs and cats by 10 a.m. every day. I'd never experienced anything like this, and I thought about quitting not only the shelter, but I thought about quitting the veterinary profession altogether. And on this random day, I'm not a big believer in fate or destiny, but on this day that I was rehearsing a resignation letter in my head, I was sitting outside of 7-Eleven, sort of stone-faced. I walked in, I got my coffee, and as I exited the store, there was a homeless man and his dog sort of tucked outside the storefront. From a distance, I could see his dog had a really bad skin condition, and I decided to approach him. The sad part about the story is I'd seen this man and his dog about 5 times before this day, but had walked right by him. And I stepped over, I introduced myself. My name's Kwan. I'm a vet. I see your dog has a skin issue. He went on to explain, yes, it's been around for a few months, and I'm just desperate for help. She's miserable. I'm miserable. It was just fleas, as it turns out. It was just a really bad chronic case of fleas. And as you know, Anne, when some dogs have fleas long enough, it just destroys the skin. This dog looked like a burn victim on its hind end. No hair, the skin was red and bumpy. I said, I'll be here tomorrow with something that should help. That took me to the shelter for one more day. And I stole a little $3 flea treatment from my shelter that day and returned back to the man and his dog. I treated the dog. And then I saw the same man and the same dog about 12 days later, and the dog was transformed. Her hair was growing back, the infection was gone, the fleas were obviously gone. And she was just full of life. Before, she was despondent, curled up, and she jumped up on me and licked my face. And the man sitting in the same spot with tears in his eyes just looked up at me, and he said, "Thank you for not ignoring me." And I just knew in that moment I wanted to find more people like him. I made him a little quiet pledge. I said, I'm I'm going to go out and do more of this and find more people like you. And that was about now going on 14 years ago. For 7 years, I didn't tell anybody about the work. So this is probably the more remarkable part of the story. For 7 years, I didn't tell a soul. I didn't tell my family, my kids. I didn't tell my brother, who now helps me run the charity. I just kept it to myself. And I think because it was my little way of healing, and I didn't want to be judged myself. I didn't want any negativity. I didn't want someone saying, for example, these people can't take care of themselves. Why should they have a pet? Why are you helping them? Why are you enabling them? I didn't want that, so I didn't talk about it until one day I shared it with my brother, and he said, I mean, there's there's an awareness piece here, Kwan, that you should be talking about. So he created a social media thing, and I don't do social media at all. He created an Instagram and a Facebook and started sharing the stories, and then it started to turn into a thing. And what was once just me has now turned into 7 cities and 15, 20 volunteering veterinarians and technicians. And it's a growing movement to find a way to help these folks. So yes, I have bigger goals now to have this expand to all corners of the country.
So, did you just like sneak around and help people who you saw on the street with their dogs and cats that were sick? I mean, how could you do this clandestinely?
I did. I would pack a little bag of medical goods, and I would go during my free time, sometimes after work or early in the morning or on lunch. Uh, it doesn't take a lot of time to run into someone in need, especially here in California. Our homeless issue, as everyone knows, around the country really is just it's horrible. And so yeah, I could drive for 30 minutes on a lunch and run into two people, and I treat their dogs or cat and move on to someone else. So it was just little pockets of free time.
So your story about the guy outside of 7-Eleven sounds like it was easy to engage with that particular gentleman. But is that what it's always like, or do you have trouble gaining the trust of these people who are living on the streets?
Surprisingly, no. I would say I've seen now hundreds, maybe it's approaching 2,000 cases in my 13, 14 years. These are individual engagements. And I would say of all of those folks, maybe 1 or 2% have declined services. I think you have to visualize what's happening on the streets. I have a backpack full of medical goods, of which I can treat about 80% of the cases I see because I'm doing wellness, I'm doing flea and tick, I'm doing really basic stuff that can make a huge difference, like I did with the dog outside of 7-Eleven. But I'm just walking up and down Skid Row with a backpack. I will turn a corner, and there behind a dumpster is a small tent pitched with someone living in it with their dog. And it's sort of a weird encounter at first, right? To see this guy who's wearing
Yeah.
scrubs and a backpack and and from a distance, I'm just very careful. I have my own routine now. From, a safe distance, I just respectfully say who I am, what I'm doing. I'm just going through the area, finding pets in need. I'm offering free medical care. And are you open to that? And most people, they raise an eyebrow at first, but say, sure. And as soon as they give me the green light, I hit a knee, I take out my stethoscope, and I just get to work like I'm in my exam room for any other hospital. And as I'm doing the exam, I'm talking through what I'm doing. The heart sounds great. The skin looks healthy. I'll take out my otoscope, look in the ears look good. And there's suddenly, in most every case, it's like immediate door of trust opens, right? They see that I am who I say I am. I'm there squarely for the needs of their pets. They're getting information they probably haven't received in a long time, if ever. And then they start asking questions, and we're just engaged. Now we're into it, and it's wonderful.
So then you kind of hinted at the answer to this question, but what what are the health problems of dogs on the street with their owners?
I'm licensed in California, so all of my practice takes place in this state, mostly in Southern California, San Diego and Los Angeles. I have moved up the coast to Oakland and San Francisco before, but in California, it's a lot of skin and ears. I would say 70% of the cases I see are skin related or ear related, meaning flea issues, allergies are a huge thing in California. By extension, dogs with allergies usually get ear infections. So I have medical supplies to address to quickly address most of those, which, as I said before, it's sometimes it's a basic treatment that can completely change that dog's life. They could be suffering or uncomfortable, even in pain, and a basic treatment for one of those conditions pulls them out of that. So that's most of it. I do wellness, so I do vaccines and rabies, occasional microchipping, heartworm, flea, and tick. And then for about the 20% of cases I can address on a corner, I will refer into a hospital. So these are things such as dental care, tumor removal, x-rays. It's maybe an internal case. I suspect diabetes, needs blood work. Those things I refer to a nearby hospital, and the charity will cover all the costs for care.
for the patients you refer.
Yes.
And so it sounds like these pets have the same things that we see in pets in New York City because, I do a smattering of primary care and this morning I saw ears and bad skin and a urinary tract infection. So it doesn't sound like these pets are really that much different than the pets that I take care of, except my pets mostly have homes and yours don't. Are there any issues for pets living on the street like that? I guess California, the weather's nice.
Yeah, we have the benefit of nice weather out here. So no, when I get asked this question, what do you see? People tend to think I'm going to give some different answer, wild answer that is far afield from what their pet, the conditions their pet experiences, or what I normally see in clinical practice. And the answer is no, it's not. It's a lot of the same things. These pets are taken care of quite well, remarkably well, given the circumstances and the lack of resources these people have. And I say that all the time because I still go out today and I'm surprised that they're well nutritioned, they're usually very well exercised and socialized. They're outside they're with their person 24/7. It's sometimes wellness care. They're, typically not up to date on vaccines, things like rabies, which is legally required. And then a lot of the same things that, yeah, I see day to day in typical practice. It's dogs with allergies, it's dogs with fleas, dogs with ear infections. And those are things I can address out of the backpack.
So these pets are clearly important to their people. Does that influence your approach to their care at all?
No, no, I guess in general, not really. I've learned to appreciate there is a different bond between these folks and their pets. And you'd have to be out in the streets and sit with them for a while to really feel it, to understand it. I've been a practicing vet for 27 years. I've seen thousands of cases in clinic. But what's different about the people on the streets is, and I just alluded to this, they're with their pets all the time, right? And so when we talk about if you're going to start to rank pet parents, right, or judge a pet parent, I say this a lot. What is a pet value above all else? Their person.
Yeah.
They want to be with their person. They don't care if you drive a Range Rover. They don't care how big your house is and how nice your furniture is or how well groomed the grass is. They want to be with you. I go to work for 8, 10 hours a day, and my dogs are peeling back the curtains, they're waiting, listening for the garage door to open, and that's all they care about. They just want to be with me. And in that respect, these people have me beat. I consider myself a pretty good pet parent. They have me beat, and most of the people I meet in clinic who have typical middle class homes and jobs who go away to work. And I want to point that out. I want to underscore that because that is so important. So the relationship I see is really on a different level. But when it comes to me as a professional giving care to these pets, it's no different. I show them the same respect and courtesy. I give them as much time as I can. So if that's a 30-minute sit down, I've spent an hour and a half, 2 hours with some people I've met in the streets, doing the full exam, talking about the care and the treatment, and then just sometimes having very personal conversations with them. But I would say in most cases, I walk away and I've just met a new friend.
I think the only thing that sounds different is that you're not in a, a very clean room with a stainless steel table to put the animal on, and it sounds like everything else is just about the same, the people, the pet, and the diseases.
It's pretty much the same. You're right. I'm under a traffic lamp and that becomes my exam room, or I'm in an alleyway or under a bridge. And That's my makeshift exam room. But outside of that, no, these are loving pet parents. I see a creature in front of me that I've have the skills and experience to treat and care for, and I just get to work. I just do it. And that's it. The reason why this whole mission journey has saved me in some ways is because when I'm in the streets and I'm giving care to a dog that may not otherwise receive care at all, or maybe in some cases has never received professional medical care, it takes me back to that 7-year-old boy. And I love that feeling. There's um when you do something without pay, but you do it for kindness or compassion, the reward to me is immense. It's so much more than someone writing a check as they're leaving the hospital and paying for services. The reward to me is it's almost transcendent. And that's why people ask me, well, how long can you keep doing this? Why do you keep doing it? That's why. Because I'm finding an animal that wouldn't get care. I develop a relationship with a stranger who is so ever grateful for it. And they feel good, I feel good, and my day's complete.
AMC has a program called AMC to the Rescue where we provide specialty care for pets that are being taken care of by rescue groups, and the pet can't get adopted because it's got some medical problem. It's got a broken leg that needs to be fixed. And sometimes we find that we don't need to fix whatever the perceived problem is. And it was really interesting to me to talk to these people when I would call them and say, now the doctors say that your pet doesn't need the surgery that you thought maybe it needed, and it can get a home now, and it has a little limp, but it'll be okay. And the rescue groups are so ever grateful for the fact that we just looked at that pet and said it's fine. It can get a home, and the new adopter should not worry about the little limp that it has because the dog's not painful or the cat's moving fine or something. And I thought that was just really, it's all along the same lines as what you're saying is how rewarding working with these pets that yours haven't homes, mine haven't owners, but doing the same thing, taking good care of them, and people are just really, really grateful for that. So I understand how you work when you're kind of out in the field, shall we say, but you also provide surgery to some of these patients. So how does that happen?
Well, again, that's all by referral. So I have some veterinary partners in some of these cities that we've established who will take on these cases at a lower cost, occasionally pro bono, which is great. Obviously, that I'm a 501(c)(3), so any breaks help. But yeah, for pets that require surgery, I will refer them in and they'll receive care by a practicing vet, just like any pet with any pet parent that's paying for the services. And again, we cover the costs of the diagnostics, the treatment, the surgery, so forth, whatever is needed beyond what I can provide out there on the streets.
Hmm. So has being named CNN's Hero of the Year changed any of that?
Well, it's it's provided a lot more awareness and visibility, I guess. And I expected that to happen, but also, yes, more donations, more resources, and yeah, more opportunities for me to do what I'm doing right here, sitting and talking with you and getting the message out. The number of requests I've got since December, I can't even keep up with, to be quite honest. It's been overwhelming, but in a good way, in a very fortuitous way. I just never, yeah, and it's changed my life too. I mean, not just professionally, but personally. There's the some of the people have reached out in the celebrity world or beyond, have made contact, I've got to know. It's been amazing. I started a dog food company with John Legend and Chrissy Teigen in May 1st called Kismet Dog Food. And that has, well, I mean, stuff you dream about as a kid. I just want to be a vet. I would have been just perfectly happy practicing being a vet, but my life and career have spun off in a very different and neat direction.
Well, I can appreciate that from my viewpoint. I still take care of a lot of pets, but I also spend time on Zoom talking to people like you and write things. And I never in a million years would I have predicted that this is how I was going to be spending a good chunk of my career is talking to people on Zoom and writing about health and disease in pets. I thought I would just take care of pets. It's kind of fun though. It also highlights what a great profession. So if your kids are out there thinking about being veterinarians, listen up. It's a great profession and has enormous flexibility.
It is
Uh,
so diverse.
the
There are so
veterinarians
many.
can do all kinds of great things.
Yeah, when I share with people, yes, I've been a shelter vet, I've been an emergency vet, I've done nonprofit, I've done government. But you can do research, you can do academia, you could be a zoo vet. You can travel the world with this profession. Your skills transfer. There's not many skills that transfer to every corner of the planet, but veterinary medicine is one of them. I am Netflix's head consultant now, so I go on movie sets and I consult animal safety. Who would have thought that was a job when I was dreaming of being a vet? Who would have thought that I have been on set with a horse that looks very much like that original Black Stallion horse that inspired me to be a vet when I was 17 years old. That is pretty full circle, and it's pretty cool.
So we have maybe not as many homeless people as in California, but we still have a lot here in New York too. And what do people like me who have a home not understand about homeless people?
There's a lot that I've learned, and I will tell you honestly that before doing the work 13, 14 years ago, I had my own set of prejudgments or notions about the unhoused. California, where I reside, is 13% of the US population. It is 32% of the homeless population. So we are in real trouble here, and it's not getting any better. But what I've found is that these folks, as I like to say, they're no different than us, and we are no better than them. We somehow look upon them, I think, with the less than eyes, that you're less than us, or because you're begging or you're asking or you're out of a home, you're not my equal. And that just simply is not the case. These are human beings that are struggling. And I would say for many of them, they struggle because they were just lacking the support that I've been so blessed to have in my life, family and friends. I've had bad bounces and bad luck in my life. And if not for a close friend whose couch I could sleep on, or parents who could pick me up financially in certain moments, maybe I would be on a street corner. So to look at them and judge and say, well, that's your own fault. This is your own doing. That's not always the case. Some people just they didn't have family. They were in foster care. They had early addiction issues. So I don't the non-judgment that we carry with the program is very important. As we say, it's no judgment, just help. And it's very important that people understand that they're just trying to get themselves out of a bad fix, and kindness is probably the best thing that you could show them.
A lot of people will judge and say they shouldn't have a pet. They can't afford it, they can't this or that. And that's a different discussion than I hear you having, which is how can I help your pet and not say you shouldn't have this pet, because I suspect for some of those people, just like for the elderly homebound, that pet is incredibly important. That's their social structure.
Hmm.
If you're living on the street, your friends may be transient, but your dog is always there. What about cats? Do people on the street have cats, or cats are harder? Cats are a little harder, I would think.
I'd say about 95% is dog, and yeah, maybe 4 or 5% are cats. And for the cats that I do meet, the cat, they're like dogs though, right? They stay close to their quote unquote home, and they have like recall. They say their name, the cat comes running. It's pretty amazing, but they're very much like dogs, but still a lifeline to these people. They just as important. And no, I've dismissed this sort of notion that they should not have pets. I see them as, in most cases, and there's always exceptions, as very remarkable pet parents who give the love, the time, the devotion, commitment on a level that many people I meet in homes do not give. How many of us can say that you would pass up on a shower and a bed uh, if your pet couldn't go with you? If you've been homeless for 2 years, unable to shower and clean up, and it's been cold or rainy, and someone's offering you a place to sleep, but they tell you your dog can't come with you. How many of us would refuse that? I hear that all the time in the street. If my dog can't go, I don't go. I'll figure it out. I'll stay right here until my dog can go with me. That really demonstrates the loyalty that these people have. There's one quick story I want to share about the lifeline part. I met a lady, this wasn't too long ago, about 6 months ago. It was raining outside in Skid Row. I was going, sort of walking down and announcing myself, listening for whimpers or any sign of a dog, and I could hear a dog rustling around behind a tent. I said, "Hello, my name is Dr. Kwane Stewart. I'm a vet. I walk the area." She came out, introduced herself. She invited me in. I saw her dog curled up there in the corner. I did an exam. We got to talking afterwards, and she shared with me, um, uh, sort of very personally, that she was going to take her life about 2 weeks prior to this night I'd met her. And by her own admission, she said, "I have been addicted to drugs for the better part of 10, 11 years. I've lost the support of my family. I've lost the support of my friends. And she says, it's my fault. I just can't seem to kick this demon." But she just thought I'm at a point where I wanted to end it all. And she had pills and a bottle of alcohol, and she was going to take the pills and drink down the bottle of alcohol. And she said she looked over at her dog, and she was curled up in her bed. And she said to herself, "If I go tonight, then who's going to feed you in the morning?" She said that thought was enough to stop her. She got up the next day and she sought care again. She says she's been through this process, but she is very serious about getting clean now. And she credits her life, not taking her life, to her dog. And I can't say that story is too far removed from a lot of people I meet in the streets, maybe not to that extreme, but for a lot of these people, their pets keep them breathing. They keep them hopeful. And that is the part that I'm trying to preserve.
That's such a great story, and I think a wonderful way to end this fascinating discussion with Kwane Stewart, who was CNN's 2023 Hero of the Year for his work with helping the pets of homeless people on the streets. So, thank you so much for joining me today. And if you want to learn more about Project Street Vet, you can go to Dr. Stewart's website, which is projectstreetvet.org. Thank you so much for joining us here on Ask the Vet today. And best of luck in your future work with Project Street Vet.
Thank you. Thank you so much.
I know you're keeping your pet healthy is very important to you. And with that said, I hope you'll reach out to me if you have a question about your pet's health. And of course, I'll answer that question on next month's podcast. Just email me at askthevet@amcny.org. We have a short break coming up, but please stay tuned because there are lots of interesting animal news stories when we return.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Welcome back to Ask the Vet. And now it's time for the animal news.
It's time for Animal Headlines, the biggest animal news from across the world.
Veterinarians from the San Diego Zoo Wildlife Alliance recently performed a groundbreaking surgery, the first ever C-section on a North American porcupine. The mother's name is Maisie, and she required assistance during labor, prompting the veterinarian team to step in and perform the procedure, successfully saving both the mom, Maisie, and her porcupet baby boy, Dakota. I love this story for the use of the baby porcupine word, which is really porcupet. It sounds maybe like some sort of lunch meat that you would get in a deli. I'll have a porcupet sandwich. But in fact, it is the correct title for a baby porcupine. North American porcupines are the second largest rodent species in North America, and the biggest one is the beaver. And while the porcupine species is not endangered, others, such as the thin-spined porcupine, are facing population declines due to habitat loss. So this historic C-section helps to ensure the long-term survival of porcupines in the wild, because we now know that you can do a C-section on a porcupine. Maisie, the mom porcupine, has fully recovered, and Dakota, the porcupet, is surviving, spinning in circles and practicing flaring his quills. The success of this procedure is credited to the dedication and expertise of the veterinary team, hospital care specialists, and the neonatologist assisted care staff who worked together to save these two wonderful animals. Now, we've all heard the saying that cats are liquid, but the question really is, do cats know that they're liquid? And so a recent study has explored feline body awareness. Body size awareness refers to an animal's ability to understand how large it is relative to its environment. And you know you have body awareness when you look at a little teeny space in a crowd of people and you try and say, oh, I can't squeeze through there. It's because you know how big you are. A trait of body awareness is known to be present in dogs, but was unclear if it was present in cats. Well, an ethologist at a university in Budapest tested cats at home by placing a thick piece of cardboard between the door frames with only a little rectangular cutout for the cat to squeeze through. When the width and the height of the hole were just right, the participating cats walked through comfortably. However, as the hole got shorter, some cats hesitated, seemingly unsure if they could squeeze through, and that was considered to be a sign of body awareness in these cats. Still, unlike dogs, the cats would often push through even if the hole was too small for them. One surprising result from this study is cats seem to be less concerned about how wide the hole was, as long as it was high enough. And this may explain their talent for squeezing into tight places. Is as long as the space looks tall enough, they're going to try and squish into something that's actually more narrow than the cat is. So cats seem to be more aware of horizontal constraints than vertical constraints. And finally, dog owners understand the special connection when gazing into their dog's eyes. Now, science confirms that this connection runs deeper than we thought. A recent study from China revealed that humans and dogs experience a phenomenon known as brain synchronization. So during this study, there were pairs of humans and their dog with electrodes to measure brain activity. And when the dog and the human gazed into each other's eyes, the brain activity in the frontal and parietal regions of the brain increased and was very similar in both the person and their dog. The synchronization increased when humans petted the dogs while maintaining eye contact. Remarkably, the paired brain activity increased each day over 5 consecutive days, indicating a deepening bond between dog and human. So this research suggests that the bond between humans and dogs is not just in our hearts, but is also in our heads. And it proves that our connection is rooted in shared brain activity. And now it's time for questions from our listeners. Our first question is from Sylvia T. in New York.
The question is, our 16-year-old tabby Leo has GI cancer and currently going down the slope. Would acupuncture help at this point? He is on lots of meds, including chlorambucil.
So I suspect what Leo the tabby cat has is a form of lymphoma in his intestine, because that's the drug chlorambucil is commonly used to treat that disease. And although some cats succumb to intestinal lymphoma, not all in my experience. And so I would ask the question, does Leo have another problem going on? Many of these cats, maybe as many as 70%, are deficient in vitamin B12. Some of these cats have pancreatitis or inflammation of the pancreas at the same time. And of course, anyone who has a cat knows that they commonly get chronic kidney disease. So I would suggest that Sylvia T. perhaps ask her veterinarian if these things have been tested for. I recommend acupuncture frequently for patients, but I think it's most good for pain, especially pain of arthritis. So I'm not sure that acupuncture is going to help Leo at this point, but I do think there are some other considerations that might put Leo back on a track to feeling better and thriving again. So good luck to Sylvia and her tabby Leo. Our next question is from Lynn, also in New York.
Lynn asks, I'm thinking of getting a hedgehog as a pet, but I heard they're nocturnal. Can nocturnal animals make good pets? Wouldn't it be difficult to take care of them if they're sleeping while you're awake, and vice versa?
So I didn't know the answer to Lynn's question because I don't really take care of hedgehogs. But AMC takes care of hedgehogs. And so I checked in with our exotics group, and they said that, yes, in fact, Lynn is correct that hedgehogs are nocturnal. So if you want to play with your pet during the day while you're up, a hedgehog is not really interactive when you're going to be up. If you work nights, maybe that's a good opportunity for you to have a pet who's on the same schedule as you are. The other thing to keep in mind is hedgehogs are spiky and not cuddly. And so if what you want is a pet who's going to snuggle with you or sit on your lap, although hedgehogs are really interesting creatures, they may not be the kind of pet that you want because they don't cuddle. And they may also not be a great pet for children, again, because children want to pick up pets and hold them and play with them. And that's kind of not the behavior of hedgehogs. The other thing to keep in mind is hedgehogs don't have a very long lifespan. And we all know how devastating the loss of a pet can be. And so you just need to think about the fact that hedgehogs don't live nearly as long as a dog or cat, and that might influence choosing a hedgehog as a pet. So, Lynn, I hope you find the perfect pet for your family. And maybe a hedgehog is just right, and maybe you need to think again. And our last question is a long one, and it's from Kelly.
And the question is, I take in a lot of abandoned, discarded senior cats. Usually there are some health issues. This is now my fourth cat with chronic kidney dysfunction. He was asymptomatic. We found it because he had a growth under his dew claw that had to be removed, and when his blood work was run to clear him for anesthesia, we found out that his kidney values were elevated. What do you think is the best way to treat this horrible disease to extend quality of life?
So once kidneys start to not work well and we can pick up that abnormality on a blood test, those kidneys have lost probably 75% of their normal function. Now, that doesn't mean that every cat with bad kidneys ultimately succumbs to kidney disease, but we know that by the time we can detect it, it's quite advanced. There's no medicine that will reverse kidney disease, and that's frustrating for cat owners as well as veterinarians. But what's been shown in scientific research is the most important treatment for cats with kidney disease is to feed a kidney-friendly diet. These kidney-friendly diets have been formulated to minimize the work that kidneys have to do in excreting waste products from the body. And it has absolutely been shown that feeding a kidney-friendly diet will extend your pet's life when it comes to a pet with kidney disease. So food is the treatment of choice for Kelly's cat with kidney disease. And now we're going to take a short break. And when I come back, we'll have news from AMC's Usedan Institute.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Hi, everyone. Welcome back to the last section of Ask the Vet. And we're now going to have important information from AMC's Usedan Institute for Animal Health Education. When it comes to dressing up your pet for Halloween, safety and comfort should always come first. Check out your pet's costume and make sure it fits well. Not too tight, but not so loose that they'll trip or get tangled up in it. Be sure to avoid any costume that has small buttons or strings that the pet could chew on or accidentally swallow. I think it's probably most important to do a dress rehearsal sometime before Halloween. Make sure that the pet is okay wearing the costume that you've picked out for them. And if the pet seems uncomfortable pawing at the outfit, trying to shake it off, or just looking distressed, maybe skipping the costume for this year and go for something simpler like a festive bandana or some sort of Halloween light up collar. Also, keep mind of the weather. If it's really hot outside, your pet may not want to wear a heavy, warm costume. Pets can overheat really quickly. especially in some sort of furry animal costume. So opt for something light and breathable if you're expecting it to be hot on Halloween. And finally, always keep an eye on your pet in a costume. Make sure they are able to move comfortably, that they have a good range of vision, and that they can breathe easily. And if they're uncomfortable, take a quick picture, post it on the internet, and then remove the costume. Now, this next news story, I kind of am sort of embarrassed to say because it's about me. On Thursday, October 17th at 6 p.m., I will be leading a webinar entitled How to Be Your Pet's Best Nurse. And as a pet owner, you always take on the role of pet nurse, whether it's caring for them after surgery, manage their medication, or monitoring their recovery from an illness. And this webinar is designed to equip you with the skills you need to excel in your role as a pet nurse and ensure your pet's rapid recovery from whatever their medical issue is. If you want more information about the webinar and to register, please go to amcny.org/events. You need to register for the event because, of course, it's free, as all our events are, but it's on Zoom. So if you don't register, we can't send you the link to join us for that Thursday night's presentation. For other access to free, timely, and relevant pet health articles, upcoming pet health events, video tutorials, and other pet parent resources, be sure to check out AMC's USDAN Institute for Animal Health Education by going to our website and putting USDAN Institute in the search bar. I want to take an opportunity now to thank Dr. Kwane Stewart for joining me today. His discussion of his Project Street Vet is really heartwarming, and I kind of choked up in tears a couple times, and I'm sure you probably did too. Don't forget, if you want to know more about the Project Street Vet, he has a website, which is www.projectstreetvet.org. If you want to know more about your pet's health or are looking for advice, please don't hesitate to email me at askthevet@amcny.org, and I'll answer your questions on the November show. The Ask the Vet podcast can be accessed on the Sirius app across all major podcast platforms and also on AMC's website. All of this thanks to AMC's longstanding partnership with SiriusXM. Don't forget to check out AMC on social media. On Facebook, it's The Animal Medical Center. On Twitter and Instagram, it's AMCNY. It'd be great if you could take a moment to give Ask the Vet podcast a review and be sure to like and subscribe so you receive new episodes as soon as they drop. I'm looking forward to working with you all next month for another episode of Ask the Vet. Thanks, everyone, and have a wonderful Halloween.